This new year, it's time to do wellness on your terms. That's where Ollie comes in. Thanks to their delightful gummies, you can actually get a good night's sleep. And you might finally stand a chance of staying focused. Because this is the year of you. Discover Ollie vitamins and supplements. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hello, Jess.
All right. So one of the most common calls in pediatrics is about a child having an earache. And about 5 out of every 6 children will experience an ear infection before their 3rd birthday. One of the largest uses of antibiotics are to treat ear infections. So today we wanted to talk all about ear infections. The clock is ticking, so let's get to it. All right, Dina, what causes an ear infection?
So it occurs when bacteria or viruses infect the small space behind the eardrum. Otitis media is an infection in the middle ear. So the eustachian tube connects the middle ear to the back of the nose and throat. When this tube becomes blocked and isn't working properly, fluid can build up in the middle ear, which then becomes a breeding ground for bacteria or viruses. This often happens when a child is sick and congested, which causes the eustachian tube to be blocked. There's also an infection in the ear canal called otitis externa, or swimmer's ear, which we see a lot during the summertime when kids are swimming a lot.
All right, so why does it seem like kids get more ear infections than adults?
Because the eustachian tube is shorter, narrower, and more horizontal than an adult, which makes it harder for fluid to drain out of the ear, which then can lead to infections. So kids often tend to get sick more with coughs and congestions, which then can lead to the middle ear infections.
All right, so what are the symptoms of otitis media and otitis externa? Did I say that correctly, Dina?
Like a pro. So for otitis media, commonly a child has a cold, ear pain, may have a fever, trouble hearing, is more cranky, and babies tend to wake up more while lying down. So we classically think about ear infections when a baby is more cranky and getting it multiple times at night in pain. Kids may also have a headache, be eating less, and sometimes parents say they are pulling on their ears more. Often though, kids can just pull on their ears when they are teething or simply for comfort too. If an eardrum has burst from the infection, you will see continuous pus leaking from the ear or stuck to that pillow or hair. This is not just a lot of earwax coming out of the ear, but actual pus draining. For swimmer's ear, however, a child will complain of pain in the ear and has often been swimming a lot. And the classic sign for us is that when we pull on the ear, the child is in a lot of pain.
Oh, no. All right. Are there ways to help prevent ear infections?
So I try to get babies off the bottle around 15 to 18 months and recommend not drinking from a bottle lying down, since this is a risk factor for ear infections. Also, don't smoke around your child. Secondhand smoke is a risk factor for ear infections. And breastfed babies, though, and vaccines help prevent against ear infections.
All right. So what are some of the treatments for ear infections?
So if you suspect an ear infection, make the appointment with your child's pediatrician who can look in the ear to determine if it's just an earache that will pass, some fluid that may clear up on its own, or if the ear is red and bulging and filled with fluid and needs treatment with antibiotics. Sometimes in order to see your eardrum clearly, just to warn parents, we have to remove the earwax or cerumen from the ear, which we know can be scary for a child, but it's something we need to do to see if a child has an ear infection or not. Depending on what we see in the age of the child, we may wait 24 to 40 hours to determine if the infection clears on its own, since about 80% of ear infections clear up on their own without medications. If your child has a more severe infection, is under 2 years old, is in pain and has a fever or a weakened immune system, they may be treated with antibiotics, which the first line is often amoxicillin. We also recommend taking fever and pain reducers such as acetaminophen or ibuprofen too, if over 6 months, since the antibiotics don't work immediately. If your child's on antibiotics for 48 to 72 hours and is still not feeling better though, you should reach out to your pediatrician again. We will also determine if your child has swimmer's ear by pulling on the ear pinna and looking inside the ear. If it's swimmer's ear, your child might just need antibiotic ear drops. If the antibiotics are prescribed, please remember to complete the whole course of the antibiotics and don't just stop them when your child is feeling better, since it might not treat the infection adequately.
All right, let's talk about school. Do we need to keep our kids home from school if they have an ear infection?
Nope, that's also the top question we get from parents, but ear infections are not themselves contagious. So as long as your child has no fever for 24 hours and is feeling better, she can go back to school.
All right, and when do you typically refer to an ENT, to an ear, nose, throat doctor?
So we start thinking of referring to an ENT when a child child has more than 3 or 4 ear infections in a season, the antibiotics aren't working, your child is having trouble hearing, or is having speech delays, or has chronic fluid in the ears. The ENT will then determine if your child may need ear tubes, which helps the fluid drain from the ear better.
And fun fact, my daughter Sophia actually had tubes put in, and it was an absolute amazing thing. She stopped having those ear infections. It was fantastic. All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.